Welcome to the ANEW Insight Podcast, empowering and inspiring your journey to optimal health. Hosted by Dr. Supatra Tovar, clinical psychologist, registered dietitian, fitness expert, and author of Deprogram Diet Culture. Rethink your relationship with food, heal your mind, and live a diet-free life. I follow my guests' journey to optimal health, providing you with the keys to unlock your own wellness path. Tune in and evolve with us. Hello and welcome, everyone. I am excited to have founder of 1000 Roads, Brad Pitzele, with us today. Brad, welcome.
Thank you so much.
I am going to pick Brad's brain on all things oxygen and light-based therapies. I've been really interested in learning a bit more, and Brad has some pretty distinct and personal experience in this area. And so I want to find out more about him. Before that, I'm going to read a little bit about him, and then I'm going to jump right into the questions. Does that sound good, Brad?
Sounds great.
Okay. Brad Pitzele is the founder of 1000 Roads, a wellness technology company focused on making oxygen and light-based therapies more accessible for people navigating chronic illness, fatigue, and cognitive decline. His work is deeply personal. After years of unexplained symptoms, Brad was diagnosed with autoimmune arthritis, cancer, and later Lyme disease, leading to severe fatigue, brain fog, and loss of physical strength. Searching for safer, integrative options, he discovered exercise with oxygen therapy and experienced a meaningful restoration of energy, clarity, and resilience. That recovery helped and inspired him to create tools and education that help others support cellular health, reduce inflammation, and build vitality in a responsible, sustainable way. Brad, welcome.
Thank you so much. I appreciate it.
Yes. So we always start this podcast off with people's inspiration to do what they do. And yours, obviously, is very deeply personal and I think a difficult road. So just give us a picture of what that looked like and how you began exploring some alternate approaches to healing.
Yeah, they say necessity is the mother of invention. In 2010 or 2011, right around then, I started to develop autoimmune arthritis and went to the rheumatologist. Got diagnosed, which was kind of a difficult diagnosis. He started putting me on medications. They didn't work, and then it was more powerful medications. As a matter of fact, he told me they wouldn't work, but I had to use them for the insurance company to approve the more powerful ones. And then I got on the more powerful ones, and they started to help. I felt better for about 6 months, and they stopped working, and I was in a worse place than I started. And then they doubled the dose, and I was not quite where I was the first set of doses, but I was better than I was as its effectiveness weaned off. And I kind of seesawed like that for 2 years on a couple different medications. And it all came to a crashing halt when I developed melanoma, because one of the side effects of those medications is higher risk of cancer, and specifically melanoma. And so I went back to my rheumatologist, and I'm like, I'm really between a rock and a hard space here. Either I die of cancer taking these drugs, or I stop taking them and I die, in disabling pain. And, I really, I had young children at the time too. And I was, it was just a really scary headspace. And, he kind of brushed it off. He was kind of like, well, let's try a different drug in the same category and see if your body doesn't respond the same way. And needless to say, that wasn't very comforting. I just, I was like, try another one and hope it doesn't do the same thing. I'm like, this kind of feels like that definition of insanity. And I walked out of the office and I was freaked out. And I just thought, I just need to find a third path, because neither one of these paths leads to anything good for me. And so I just started researching, and, I became my own kind of crash test dummy. I was trying everything I could. I tried diet modifications, supplements, all sorts of healing modalities, and nothing worked. Nothing did anything of meaningful benefit. And then I started seeing a holistic doctor, and he's like, we're going to get you tested for Lyme disease. And the test was expensive. It was like the tests they offer you for Lyme disease are not accurate. So you have to use these $500 tests that the insurance doesn't cover. And I just thought to myself, I don't have Lyme disease. I never was bitten by a tick. I didn't have that bullseye rash thing they talk about, but I'm going to pay the $500 just so the doctor gets over it. We can move on to what's real. Lo and behold, it came back. I had Lyme disease and a co-infection known as Bartonella, and which co-infection meaning that when you get Lyme, you often get these other infections that kind of team up to beat you up together. And I didn't even believe it. I went back to him like, is there a chance it's a false positive? And he goes, well, it's a urine PCR. So that means you have the DNA of those bacteria in your urine. What do you think? And I'm like, okay, well, I guess I accept that. So yeah, that was kind of an eye-opening moment. It was good because I now had a name for this thing because it had moved beyond the arthritis symptoms. It had, the backs of my legs had gotten stiff. The bottoms of my feet were in tremendous pain. It's hard to come up with words to describe what they felt like. I was in so much pain. I couldn't get out of my bed and go to the bathroom in the middle of the night without putting a special set of shoes on. I couldn't walk that far without them. I had brain fog, I had energy issues. I mean, so many symptoms. And I actually went back to the rheumatologist when my legs started to get stiff and the bottoms of my feet started to hurt. And I said, hey, is this also, arthritis? And he kind of looked at me like there was a horn growing on my head. And he's like, that's not arthritis. And I just left there and I'm like, what do you mean? Like, this is whatever's going on in me, this is the same thing. And like, I don't understand how we can say it's something different. It's not. So that was kind of tough.
But was it more that you just had Lyme disease and the arthritis was a symptom of that? They just didn't understand?
That's exactly right. Yeah. So when I got that Lyme disease diagnosis, it really helped kind of bring all these symptoms together, right? I had an overarching thing that was causing them, which was relieving in itself until you do some research and you try to get treatment for Lyme disease. It's very difficult. Traditional medicine doesn't even like to half the time they don't even want to admit it exists. And
what are some of the traditional medical treatments for Lyme disease? Because I know people with Lyme disease and I know that they're not that effective.
No, they're not. So if you were to go to a traditional doctor and say and you were to get diagnosed with Lyme disease, which is hard with traditional tests, they would tell you need to go on a short course of antibiotics. And then after a couple of weeks of antibiotics, most people won't get better from that because Lyme disease is what's known as like a persister infection. It can kind of hide out and go into dormancy for years. And so as soon as the antibiotics start to get it, it goes into dormancy and just waits until the air is clear, so to speak, to come out of its foxhole. And so what they do in traditional medicine, oh yeah, well, we'll give you 3 weeks of antibiotics or whatever it is, a few weeks. And at the end of it, if your symptoms are exactly the same, we just tell you don't have Lyme disease anymore. We don't know what it is and there's no treatment and just move on with your life. And it's like,
wow.
With people who've experienced it, they're like, but I feel identical. Yeah, but you don't have it anymore. We've removed the title.
Wow.
Yeah. So it's a tough disease. I mean, I've had to walk in and have conversations with doctors and about the legitimacy of if Lyme disease exists, which was shocking to me. I'm like, this is a real bacteria, right? And it does really infect humans, right? And which was kind of, it's and that's still happening, now in 2026. We're not talking that far in the past. I've had those conversations. I think it was in the last year or so. And so that's always a little bit of a challenge, and it's really hard to get better. People get Lyme disease because it's a persister bacteria. It just sticks around, and it's not easy to recover from. And it's also known as the great imitator. So there are people who think they have multiple sclerosis and they have Lyme disease. There's people who have autoimmune conditions. It turns out they have Lyme disease. There's people who are dealing with Parkinson's and Alzheimer's symptoms. They're dealing with Lyme disease or nerve pain, fibromyalgia. So it presents different. I mean, if you and I were to get Lyme disease from the same source and the next 10 people, we might all have a totally different symptomology. And so
And why does the test cost so much? And what is the traditional way that they try to test for it?
They do what's called a Western blot as the traditional test. And what that looks for is different bands of your immune system being activated. It doesn't look for the bacteria itself. It just looks for your immune system response to said bacteria. Now, my understanding on it is in the early days when Lyme disease was discovered, when a bunch of children in Old Lyme, Connecticut started to develop arthritis. And so they were trying to figure out what this thing was. They're trying to do some research on it. And so they needed a test for laboratory purposes that they were like 100% sure this person really had it. And so it was a very stringent test because you didn't want to have any false positives in there because it would muddy your research. And that test was never meant to be used for diagnosis. It was never meant to be dragged over to the clinical setting and used for diagnosis because it's known that the Western blot test, if you have Lyme disease, there's a 50% chance it'll come up negative. So if you
Wow.
have it, you've got a coin flip odds that whether or not it detects it. And as I mentioned,
It's because of the latency versus the, kind of immune response back and forth that happens with Lyme disease.
yeah, Lyme's really, when you study Lyme, you find out how incredibly intelligent bacteria and some of these small things are, and people don't appreciate. They think we're humans, we have these big brains, and we're on top of the hill, but it actually can exist in multiple different forms. And it's very good at evading the immune system. One of the ways it evades the immune system is it causes inflammation in your body, and then that inflammation damages tissue, and then it infects the damaged tissue. So it'll move inside your cells. So it's intercellular inside the cell wall, and your immune system isn't really designed to work inside the cell wall. Now, you do have defenses inside your cells like lysosomes, but the cell is damaged and it's like on life support and it doesn't have the energy to go after these intercellular infections. And so your body really doesn't know what to do. And, you've heard a lot in COVID about these spike proteins. So when we're talking about viruses, that's how we're identifying them. It's like it's known as outer surface proteins in the Lyme community. The cell has these different proteins on it. And that's the way the immune system basically, it's kind of like a lock and key. It notices that key and says, oh, I recognize this, and it mounts an attack. Lyme disease will actually change up its outer surface protein continually, just so your immune system never it goes and finds yesterday's
Wow.
Lyme disease and tomorrow it's different, sort of thing.
Crazy. That
Yeah.
is crazy. There's a lot of theories too on autoimmune disease. It's not necessarily the body attacking itself. It's that there's bacteria or viruses that are hard to detect. And
Yep.
the immune system is having a response to them. Epstein-Barr is one of them. And they think that there's a theory that might be the reason why people develop long COVID and
Yes.
persistent autoimmune diseases.
Absolutely. Yeah. It's linked to Hashimoto's. It's linked, which is an autoimmune disease. It's linked to chronic fatigue syndrome, big time.
Yeah.
Well, I always find it kind of silly when we just say the body just is misbehaving. It's just like has an error. Like,
Right.
here's the thing we got to think about is life has been around billions of years, and humans, we've been around at least hundreds of thousands of years. And if we had this defective immune system that just body parts that just break down, how did we survive? Like,
Exactly.
it doesn't make any sense. And I think the funny thing about autoimmunity is they know it in common literature. They'll tell you autoimmunity is generally caused by infectious agent or toxins that cause the body to attack itself. That's actually not controversial. But
Mhm.
then when you walk into a rheumatologist's office, for instance, what they'll say is, hey, we got to give you these drugs and you can't take them when you have an infection. You can't take them because they tamp down your immune system. So here's what we're going to do. We're going to make sure we test you for tuberculosis. That's it. They only test you for tuberculosis. It's the
Oh,
only
wow.
infection. There is no other
Because it's
infection we
so
test you for.
common.
Yeah. Well, probably someone in a clinical trial got very sick or died because they had tuberculosis. So they have to test for that. But then they'll put on the packaging of some of these things, but don't take them if you have an infection. It's like hear no
Wow.
evil, see no evil. So it's
So it has
it's
a long way to come.
yeah.
Then we have this other test, which is accurate and to actually test for Lyme disease, and paint a picture of how you transitioned and found your way to oxygen and red light therapy.
Yeah. So the doctor recommended to me, he said, you need to do some sort of therapies to improve your oxygen intake utilization. And he gave me several examples. The first one I'd heard of was hyperbaric oxygen therapy. And then the next one he mentioned was exercise with oxygen therapy, also known as EWAT. And so I immediately researched hyperbaric oxygen because I'd heard of that and I'd never heard of this EWAT thing. And the protocol for Lyme specifically was there's like you had to go to a doctor's office and get in a hard shell hyperbaric chamber, not the soft shell ones you see LeBron or someone else using, an athlete using, like the medical grade ones. You had to spend 90 minutes in those chambers, 7 days a week, plus time to the doctor's office and back. And the cost was going to be enormous, but I could get a great deal if I would fly out and do it in Florida. This doctor knew about someone who was offering practically half price in Florida. It would have only cost me $50,000 or $75,000, plus the trip out there and wherever my housing was.
Wow.
And I had so many problems with that. First, I was fighting for my job with my energy and brain fog issues, and I knew I couldn't take 7 days off for 6 weeks or whatever it was going to be. Second was the price tag. I tried everything and nothing worked. Now, with Lyme disease, when you treat Lyme disease, sometimes you get something called a Herxenheim reaction, which is if you can and do manage to kill off a bunch of Lyme disease, it releases like this toxic payload inside of it, and it overwhelms your elimination organs. And you feel like you're hungover or like you have a really bad flu. And so everything I tried, I was actually hoping I would get this Herxenheim reaction because at least I knew I was moving in the right direction, but nothing worked for me. So here I was like looking at someone's going to cost me the same amount of money as a vehicle. And I was like, it's just another experiment and every other experiment's failed. So I quickly shifted over and looked at exercise with oxygen therapy. It looked more promising because you only needed to do it for like 15 minutes. If I bought a system, I could do it in my home. I could do that in the morning and still make it to work, sort of thing. But it was cost prohibitive too. The people who were selling at the time wanted $5,000 to $25,000, and I didn't really have that kind of money. And it was another experiment that even if I had the money, I just it's hard to pay that kind of money for an experiment you feel has got a low probability. So
what is it exactly for the listeners who don't know?
Yeah. So what it looks like is it's essentially what you do is you do 15 minutes of cardio while you're breathing oxygen through a mask. And so if you were to look at the device, what it looks like is there's a electronic device you plug into the wall and it purifies oxygen out of the air. The oxygen we're breathing, let's say at sea level, is 21%, and it purifies it up to 93% oxygen. So 4.5 times as much oxygen roughly. But the problem with those devices is they don't put out enough oxygen for the amount you need to exercise. So what you do with them is you use them to fill this large reservoir filled with oxygen. It's about 1,000 liters, which is, if you think about a 2-liter bottle of soda, think about 500 of those. So it's a big balloon looking device. It's like, let's call it 6 feet by 6 feet roughly. And you fill that with oxygen, and then you hook a hose up to a mask and you put the mask on and you breathe through that while you do exercise. And it, as complicated as that may sound, it's actually relatively simple. It's hooking up a couple pieces of tubing and hose and plugging something in the wall and flipping a switch. And, other than that, the hardest part is maybe putting a mask on your face, which isn't too bad.
And what is
Um,
it supposed to do exactly?
yeah, so this was kind of like an eye opener for me. Oxygen is like, we all know oxygen's important, right? We hear, the reason why there's life on Earth is because of oxygen. What we don't realize, and no one really talks about, is as you age, every year past 25, your body loses 1% of its ability to utilize oxygen, which doesn't mean much at 26 or 32, but all of a sudden you get to 50 and, oh, look at that, you've got 25% less oxygen. And oxygen is incredibly important in our body for a variety of functions. The most obvious one is energy production. So if you take a cell and it's deprived of oxygen, and then you turn around and give it oxygen, it can produce 20 times more energy with the oxygen than without it. So the
Mm.
opposite's true. If you take that oxygen away, it has to go into what I'll call like a survival mode. It's like, 5% energy. And so it's just not even doing all the bare essentials. And it creates a lot of problems for our bodies. And it happens to everyone, but we don't really talk about it. So the so it's really critical. So, and that's not just like, hey, do I have enough energy to get through my day? It's definitely that, but it's like clear headedness and brain fog. It's your liver doing its job, your brain doing its job, your heart, your skin, all of these things. Whatever the cell is supposed to be doing for you, it needs oxygen to do it at its best.
So essentially, exercise with oxygen could help with a variety of difficulties and ailments.
Yeah, we've got people with all sorts of chronic health conditions using it, everything from cancer, autoimmunity, long COVID, chronic fatigue, Alzheimer's, concussion, stroke, Parkinson's, so many things. Because here's the other really interesting thing about oxygen. Anywhere in your body, you have low oxygen, you have inflammation. And anywhere you have inflammation, you have low oxygen. So they're just two sides of the same coin. And so we all get slowly starved of oxygen as we get older. And so we slowly inflame. And now, in Western society, we've now named this inflammaging. Like we're all
Yes.
just supposed to get more and more inflamed as we get older. Well, that's directly correlated with our decline in oxygen.
And I would say too, lifestyle and diet and all sorts of things for
Yes.
sure. Let me ask you this. What about the people who are doing relatively well, who are, energetic for their age, but they want to improve their health span? How does
Yeah.
oxygen therapy help with that?
It's, oxygen, EWAT specifically, is very anti-aging at a very foundational level. So the way EWAT was discovered is Austrian physicist and inventor in the 1960s and 70s was looking at Otto Warburg's work. Now, Otto Warburg was around, he got the Nobel Prize in the 1920s for showing that he could turn a regular cell into a cancer cell just by starving it of oxygen. So this Austrian physicist and inventor, Manfred von Ardeen, in the 1960s and 70s started to experiment with oxygen and exercise, and he found out something fascinating. And that is, as we get older, this inflammation that builds up in our body builds up inside our circulatory system. And our capillaries are thinner than a human hair. Those are like the end runs of your circulatory system, where the rubber meets the road, so to speak, where you actually are exchanging nutrients and oxygen with your cells. And they're thinner than a human hair, and they're actually smaller than a red blood cell. And so red blood cells, the way they get in there to deliver oxygen is they have to fold up like a taco to fit in. But as this inflammation builds up, two bad things happen. One is the walls of the capillaries swell shut, and the red blood cells become less flexible, so they can no longer fold like a taco and get in there. So now what you have is a situation where all the cells downstream from that swelling are not getting oxygen. And
Mhm.
now all those cells are on that life support mode we talked about. And what happens, one of the major things they stop doing is they stop detoxifying. They let all the metabolic waste products build up inside the cell wall because they don't have energy to take the trash out. But what he found was when you do exercise with oxygen therapy, we oxygenate parts of the blood that normally don't have oxygen called blood plasma, and it's about 1,000 times thinner than a red blood cell. So it gets past those blockages. And because oxygen's so anti-inflammatory, it creates an anti-inflammatory effect that reopens our capillaries and reestablishes more youthful blood flow. So even when you're done doing EWAT, he discovered he had elderly folks do just a few sessions, and they came back weeks later and their capillaries were still reopened, and they were able to exchange oxygen and red blood cells. And so it's anti-aging at like a cellular level.
Yes.
And
I would assume that if you have, a relatively healthy lifestyle and you have very little inflammation, and work to reduce your inflammation, you could increase your capacity for oxygen just with that. But adding exercise with oxygen, it's like you're a superhero on top of that.
Yeah, I mean, because at the end of it, oxygen is so anti-inflammatory. It is, you can't compare it to blueberries or a wall. It's so essential. And anywhere, yeah. So it's pretty amazing.
That is very cool. So I have 80,000 more questions for you, but I really appreciate your deep knowledge on this subject. It's really helpful for people, and I think that this can give a lot of people some hope if they're experiencing chronic illness, autoimmune issues, that there is, viable treatments out there that are hopefully not so expensive, but we'll get into, how that might be cost effective for people moving forward. But are you ready to come back for this second half of our recording after this?
That sounds great.
Thank you guys for joining us. Tune in next time for this second half of this wonderful interview with founder of 1000 Roads, Brad Pitzele. Thanks for tuning into the ANEW Insight Podcast. Please remember, the contents shared on this podcast is for entertainment purposes only and does not constitute medical advice. You can find us anywhere podcasts are streaming, on YouTube at my.anew.insight and at anew-insight.com under the ANEW Insight Podcast tab. And follow us on our socials at my.anew.insight on Facebook, Instagram, TikTok, and Threads for more updates. Tune in next time and evolve with us.